everybody. We are back, and Dr. Todd Shatkin is with us, and we're pretty excited because he's got something that I think you're going to find very, very helpful and useful if you've been thinking about his mini implants, but perhaps you already have a full set of false teeth, but you would like to actually bring that up into the future. There's a better way to even do that. Dr. Todd Shatkin is back with us from the Aesthetic Associates Center. Hello.
Good
you came in the bad weather. I appreciate it.
It is so cold out. My goodness.
You almost want to do this, teeth chattering.
You know, I was in Dallas this weekend, and the cold was there, too. You can't escape. It was 30 degrees in Dallas, so it's not. It's cold all over the place, not just Buffalo.
I know. So it's a perfect time to come on in and fix your chattering teeth, right?
There you go. Sure.
Take a look at these, everybody, because as we know, Dr. Todd Shatkin really invented an incredible way to have mini implants done. And now he's going to show you how you can do this if perhaps you're already wearing a full set of false teeth.
Well, here's an example of a lower denture, which, you know, a lot of people have. But these dentures slide around a lot. So what we do is we put these mini implants, 4 of them, just like this, in the lower jaw, and we put little O-ring, rubber O-ring housings in the denture, and then this denture will snap right into place, and it won't come out.
Wow.
It snaps on. It's very easy for the patient to snap it in and snap it out to clean it, but they don't have any problem with eating. The denture stays very stable. They can eat basically corn on the cob, apples, anything they want without worrying about their dentures moving around.
Now, if their jaw continues to move, I would imagine, I'm going to take these out, you can always realign the ones up here.
Sure.
Instead of being invasive in their jaw again.
Right. You can reline the denture at any time, but what's great about the implants is it preserves the jawbone, so they really don't get the shrinkage anymore. Once they have this done, their shrinkage pretty much stops.
And that's only 4
on the bottom.
And look, you can put all the teeth in. That's amazing.
And this is, you know, we've talked before about permanent fixed bridge work on mini implants, which we do all the time, but this is a much less costly option for those people who suffer from loose dentures. Now you have the other individual who has trouble with their upper denture. Maybe we can show this denture as well.
And we'll take calls, too, so if you see something you have a question on, give us a call.
Can we zoom in on this?
We're going to take a look at this upper denture.
And what this is a denture without the palate. So a lot of people suffer from a gag reflex, and they don't like the roof of the mouth being covered with plastic. And so what we can do with this, by putting these mini implants in, here we put 6 in, we can remove the entire palate from the denture and snap the denture in place that way.
That's amazing. So that's got to be so much more comfortable and more natural feeling for patients.
Now they taste the warmth and the cold of the foods on the roof of their mouth, and they also get taste buds on the roof of their mouth, so they taste their food better.
So you could have people who have a full set of dentures now come on over and say, I'd like to replace these with these. Right. If they have the jawbone. Yeah,
and a lot of times we can actually use their existing denture.
Really?
We can retrofit their denture so they don't have to go through the expense of new dentures. We can, you know, retrofit them to the mini implants and remove that palate for them.
That's amazing. And the third example you have here are the implants per tooth.
Right. Well, this is an example of, here is just a single tooth replacement. Let me see if I can take that off.
There you go.
Here's a single tooth that would be replaced with a mini implant and then cemented in place. And here's an example of a bridge with 4 mini implants. And that, again, would be cemented in place.
Right, so they would never take those out.
They're cemented in.
Amazing.
This is if somebody has a lot of their own teeth but is missing 1 or 2 or 3 and want to just replace those.
Phone call for you. Hello? Good morning.
Yes?
Yes, go ahead, please.
Yes, is this for doctor?
Yeah.
Good morning.
Yes, I'd like to know what insurances cover this.
Well, insurance companies actually are starting to help pay for some implants. It depends on your policy. I'm not averse at what insurance companies will cover and what won't, but you certainly can call our office and speak to one of our staff members, and they can either tell you or they can call up your insurance and find out if your policy covers implants. But many times, if they don't cover the actual implant, they would cover the denture or the crowns that go on top of the implant, so you might get partial coverage either way.
All right, great. All right, hopefully that helps that person. You know, sometimes people who wouldn't ordinarily be home today are home today watching. And it's just like one of those fortuitous things where all of a sudden we do a segment that's exactly what they need, you know, at home. And I'm hoping that that's going to be the case with folks at home, because sometimes people think, a lot of these processes aren't for them, and it's
Right.
exactly for them. I mean, this is just has been terrific.
Thousands of people suffer from loose dentures out there. I mean, hundreds of thousands, and they don't need to suffer. It doesn't matter what your age is. This is such a simple procedure. We don't do any cutting. There's no surgery involved. We do it through a little tiny pinhole in the gum, and the implant is threaded in, and the whole procedure to stabilize a denture is less than an hour.
That's amazing. You know what, too, Dr. Shatkin, is that what will happen is that as dentures become more and more uncomfortable, people will opt just not to wear them.
Right.
And people don't want to do that, but they end up doing that.
Especially if you have that gag reflex and you just can't keep it in your mouth, you know, and there's no other way to keep it in without, you know, using some adhesive and sticking it in there. And if you gag on that material, it's just very difficult.
I can only imagine how happy some of your patients are who
They really
have now
are.
completed this process and just love the way they look.
We've been doing this for 7 years, and everybody that we've done this procedure on is thrilled.
Oh, my
Everybody.
goodness. A beautiful smile and easier than you think. All right, let's let you know how to do this. Dr. Todd Shatkin truly revolutionized this process, and he is there for you at the Aesthetics Associates Center. Wonderful staff there, 2500 Kensington Avenue in Amherst. You'd be surprised how fast they can do it as well. 839-1700. Somebody there to answer the phone today?
Yep.
Absolutely. 839-1700. Call today and receive the smile you've always
And
wanted.
they can have a complimentary consultation as well.
My goodness, you can't beat that. All right, everybody, 839-1700. Give them a call right now.